Hi, everybody. I have a guest. Did I not tell you that I would get a friend to come? So, everyone, this is Cristina. I've known her for how many years now?
It's been a hot minute since we're 12, so let's do the math.
Yeah.
Almost 30 years. Let's put it that way.
Okay, yeah, it's true. I've already said my age. I'm like, you just aged us, but it's okay. Okay, so she's one of my besties, and we brought her on because she is an ER nurse and she has the craziest stories. I hear them all, and I'm like, no, people need to know what the hell is going on. Can you please open this?
Oh, yes.
There we go. Okay, perfect. Okay, so I prompted her with some questions so I wouldn't, throw her off. But actually, wait. Let's cheers. So this is gonna be Thirsty Thursdays. Cheers. Have we had about 3 glasses each before this?
The bottle's done, and we're
So basically, we're ready to rock and roll. So happy Thursday. Cheers to everyone. Chin chin again. Thanks for coming on.
of course.
Okay, great. So we're gonna dive into them. So I wanted to ask some questions that I knew that people wanted to know slash I love knowing slash are juicy. So let's get right to it.
All right.
Question number 1. Oh, wait. How long have you been a nurse for?
Oh my God, I hate when people ask me this because I'm very good at math, but when it comes to telling people how long I've been a nurse for, it's like I can't. So I graduated in December 2016, so almost 10 years of being a nurse.
Okay, so she has some experience under her belt, so that's good. All right, perfect. So, what's the one ER story you still think about years later?
So I actually wasn't a nurse when this happened, but I was working at the hospital and I remember it and I followed it on the news after because it was so crazy and I was just shocked and I was young and I didn't have experience, but it was a patient that came in. They were leaving their job in the middle of the night in the dead of winter. It was like -30. It was like a whole super cold outside, crazy -30 weather. I remember crossing over some train tracks and there was a park train and then the patient was crossing over. I don't remember the story exactly if the patient had headphones in their ears, but didn't notice that there was another train behind. Hit them.
Oof.
They were projected, and the cold saved the life because it was so cold. The patient was only found hours later, and because it was so cold, the patient didn't bleed to death, but also ended up having permanent, like, limb damage slash loss because of the cold.
Oof, a train. Oh my God.
Yeah, but it was a nice story because the patient was able to learn how to live after the loss and regain mobility and have a life after.
And how old were they?
20s.
Oh, yeah.
Super young. Yeah.
Do you mind opening again?
Oh, yeah.
Sorry. Okay, God. Okay, that's crazy. Yeah. No, I don't. Yeah, I don't know how you get back from that, but that's crazy.
Yeah.
Okay, what's the craziest thing someone has come into the ER for that turned out to be way less serious than they thought?
Um, so we get pre-calls from like the ambulance telling us like, prepare this, prepare that. We're coming with this patient. It's critical. There's like a protocol to follow. And when we get phone calls for patients that are stabbed, it's automatically like a big thing because it's like a stab. There's blood loss. It's dangerous, especially if it's like in the chest cavity or in the abdomen. You have to like activate and have all the like people present and the blood products and this and that. So, you get a phone call from the ambulance. They're like, yeah, we're coming in with like a woman stabbed in the abdomen. And you're like, oh, okay. So you activate everything that needs to be activated and they come in and it's literally like a paperclip scrape their stomach and it's not penetrative and everyone's standing there gowned up and ready to go and you're like, okay.
You're like, so a band-aid?
So, okay, good for them because they're not dying and you're super happy. But like, okay, so it's like almost like an overreaction, but you have no choice because it's like the time you get that call and it sounds iffy, you gotta, you gotta activate. So no choice but to do it. Sorry, guys. She's
Yeah, that must be so frustrating and a waste of freaking time for all the ER doctors that are called
the
in.
trauma team and
Yeah,
everything. Yeah.
and the
Well,
trauma team.
I
Yeah.
mean, it's not a, like, yeah, like, I mean, but it's just like, okay, they arrive and you're like, oh, okay. So do you still need us? No, we're good.
No, see, that pisses me off. Like, also, the ambulance should be like false alarm, false
They have no
alarm.
choice because they have like a criteria, and you sometimes you don't know. Also, it might look superficial and it's deep, vice versa. So it's better to be safe than sorry. That's what I always say.
Okay, also, this is a whole ass off of our track here. Someone I've spoken to people and they're like, yeah, yeah, yeah. Like, sometimes instead of waiting so long in the ER, I just call 911 and get an ambulance because you get seen right away. So when like something's bad is happening and like whatever, we just call 911 and we get seen right away. And that's the protocol when you're with an ambulance. And I think that that is such bullshit.
It's not true.
No, but it
So
is true.
no,
Literally, someone I know, they're like, well, they were having a headache, so we called 911. I'm like, a headache? You wasted
no.
an ambulance for that?
We have a specific criteria that we triage patients with based on their symptoms. Doesn't matter whether they've walked in or come by ambulance or taxi or a family drove them. It's
Okay.
really based on the symptoms you come in with, and there's like a whole scale and criteria.
Okay.
So
So that makes
your mode
me
of transportation doesn't affect how fast you're seen.
and
And
my
often it's the walk-in patients, not the ambulance patients, that are the sicker ones.
yeah.
You get a little old person coming in, they're like, oh, I'm not feeling very good. And then you do the cardiogram and you're like, oh, well,
You're having a heart
you're
attack.
having a heart attack.
Ugh. Okay, well that actually makes me feel way less angry and better about the situation. So thanks
Don't
for
be
clearing
angry.
that up. I was, and I'm no longer. Okay, next. Without naming names, what's the most shocking or unbelievable thing you've seen on a shift? Wait, this is the question that I wanted to change. Sorry. I'm reading this out. It's the wine. It's the wine. Okay, wait. What's the most
Because we kind of covered that with
we did,
the
yes.
story.
So she let me know and then we're like, hey, we're gonna change it, and then I just read it. So the change up, sorry.
It's a bit too much wine.
No editing. This is a one and done, guys. So bear with us. What is the most embarrassing thing that's happened to you on a shift?
Actually, this week.
Oh,
Yeah.
go.
So I was working in the triage. So, coming in, patients coming in, telling me what's happening. And a patient came in and starts describing some symptoms of what's going on. And then I kind of like stop and look at them and I'm like, are you here for an allergic reaction? And she's like, she already heard this story. That's why she's laughing. And she's like, what? No. And I'm like, well, you're really swollen everywhere. Like, are you like the medications you're taking? Like, you're having a reaction? Um, her boyfriend was there and she's like, am I having an allergic reaction? And he went like this. I don't know why he needed to zoom in because what I was seeing could have been seen from the moon. Okay.
So wait, people on Spotify, he zoned into her lips super close.
Zoned in super
Oh.
close. And they were so swollen you could see them from the moon. To which she replied, she's like, oh no, I pay to get my lips big. So I wanted to just shrivel up and die in that moment.
And then I asked you, she didn't even get upset
No,
or mad, right?
no insight or upset or anything. She was just like, no, I pay to have big lips. And I said, oh, I'm really sorry. I'm really sorry.
And wait, did the boyfriend look like, oh yeah, those are the sexiest lips, or was he like
I think he
mortified
was
when
a
you
bit
asked?
lost, like as lack of insight as she was into the
Okay, so two
situation.
fried potatoes. Okay, got
They
it.
they like that,
Yeah,
and
yeah.
to each their own.
She's being so politically
I
correct
wanted to
right now.
die. I wanted to die. I
Absolutely.
literally want to crawl under the desk and just die. And then I literally had to write it like, like not an allergic reaction, lip filler, just to like,
Yeah,
because
believe her.
anyone who walked in the room would be, you know?
Oh my God.
To the Cosmo Kramer.
Yeah. Oh my God, the best. Love a Seinfeld reference. Love it. Okay, next. What's the grossest thing that you've dealt with as an ER nurse that people outside healthcare could never imagine?
It's always bugs.
Bugs. Oh,
I mean, I don't care how much gross things are out there, feet, mouth, smells. For me, bugs.
but explain.
Bugs.
No, 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 no.
Bed bugs, maggots,
But to say,
lice.
okay, no, no. Yes, everyone knows about those bugs, but they're wondering how those bugs are in the ER. So explain, please, immediately.
Well, patients come in, whether they're found in like an apartment that's completely full of bugs, or, if it's like
Homeless.
a homeless, not always homeless though, I have to defend them in this one. It's not always homeless. Often it's like, patients coming in and the ambulance will tell you, they're like, oh my God, the apartment was covered in cockroaches. And I'm like, it's like a panic sets in and I'm like, oh, just kill me.
Yeah.
I'll deal with any bodily fluid any day
Oh.
over any bug.
Oh.
Any smell, give it to me. I'm here for it.
No, but wait, can we just give a shout out to nurses? I actually was like, oh no, I'll take bodily fluids, but no, I don't want either. I don't want bugs. I don't want fluids.
It's not just us, it's the whole team, the orderlies, the nurses, the doctors. We get up in there.
Yeah.
It's a team effort.
No, no. And like, thank you. Thank you. On behalf of all of my 3 people that watch, thank you. Okay, wait.
Always the bugs. If I had to pick one specific bug in order of fear,
Bed bugs.
bed bugs is my like number one. I will take any bacteria. I will take a bacterial meningitis over a
No,
bed
no.
bug. Yeah, yeah, I will. Over a bed bug. That's how scared I am. Lice is number two.
Oh yeah,
Um,
lice. Oof. Yeah.
and then maggots.
Oh, I remember maggot stories.
Yeah.
Tell a
I
maggot
don't I
story.
don't really have many, thank God. Uh, but the maggot in the ear was one that, yeah, I was just like, nope, I can't.
And it wasn't that they came in for the maggot, you just found it?
No, they were like, my ear hurts.
Okay, so they
And
came in
then
for
went in.
it. Ugh. And maggots breed on dead things.
Well, it's
So
a good thing. It's a good thing, but like not. And also, like, I've worked on a unit where we had like a complex wound and we had to do like leech therapy.
yeah.
That was freaky too, because it's like it goes on and it like sucks the blood and the edema. Very freaky.
And that
Not,
okay.
nope.
But that's
Even though
like
it's like a clean
medical.
bug and medical, it's a bug.
No, it's still super gross,
I'm not
but
here for it.
ugh. Okay, next. What are the biggest mistakes people make before going to the ER and what should they actually do instead?
Um, it's a tough one, without getting into the whole political situation. I would say, like, when I'm working triage and I'm like, okay, what brings you in today? And the person starts and they're like, well, I've had knee pain for 6 years. And I'm like, so I try to bring it back and I'm like, well, today, what's going on? Like, what is it about today?
Today.
What is it about today that made your 6-year knee pain a medical emergency? So I would say like that, but it's also like I understand because it's like you have nowhere else to go or you don't know what to do and sometimes it's like you don't have a doctor, you don't know what to do, so you just kind of come in and it's like from there, you're kind of presented with the options. But yeah, I would say that's like the biggest mistake we see is like a lot of chronic issues that it's like, what do you expect today to be different from the last 6 years or the last 10 years?
Do you find that you have a lot of people that come in with just like a regular, like 6 on 10 cold and they're going to the ER and wasting your time and you're like, take a Tylenol and go to
For
bed?
sure. And then for me, there's always like a fear in the back of my mind that I'm going to send the person home.
Hmm.
Even though everything's stable and everything looks fine, there's always like a fear in the back of my mind. I'm going to send the person home or say, like, take an appointment, like, do this or do that. And it's like, what if this person goes home and dies? even though it's just like so preposterous, this fear that I have in my mind, but like,
No, I
because
totally
it's
agree
your
with that.
license and your
No,
reputation and your work in the end of the line. But it's like, at the same time, it's like, bro,
like I feel like you must be thinking like surely it's more severe than I can see if it brought them to the ER. But then
not always though.
I
Some
know.
people just panic, I guess,
Yeah.
and just can't cope.
Yeah.
Like, really can't cope.
Mm, okay. What's the best health advice that you can that you could that sorry, what is the best health advice that could genuinely save someone a trip to the ER if you had to think?
Health is wealth.
Mm.
So I think prevention is key, as cheesy as it sounds or cliche as it sounds.
But prevention how?
You really just have to appreciate your body and take care of it. If you don't, then you're going to get sick and things are going to happen. But if you take care of your body, like just a minimum taking care of your body, shower every day,
You're really
eat.
getting down to the nitty gritty.
No, like, eat, exercise,
Yeah.
a little bit of stretching.
Vitamins, supplements, eating healthy, water.
Yeah, water.
But it's so
Min
crazy. You're
it's
saying the bare minimum.
yeah, but I find like we don't prioritize that enough. Like, I feel like back in the 90s you would see like the body break commercial and they're like, "Come take a walk with me 10 minutes for 3 times a day. Feel great." And now you don't see that on TV anymore. And
Mm-hmm.
it's like it's cheesy, but it's minimal effort and it really does a lot in the long run.
Excuse me. Do you remember Body Break?
Well, that's what I just said.
Oh,
Body
Body Break.
break.
Okay, yeah. If you rest, you
Was
rust.
it Al Johnson? What was his name? The guy.
I don't know,
I'm
but like
probably
Body
yeah, yeah.
Break. Yeah, I'm not gonna sing because people pay for this voice. Okay, but obviously I'm joking.
I'm
but
not gonna sing.
but those commercials came every seventh commercial, and I was like, yeah, when you rest, you rust, man. You rest, you
But
rust.
it's like really 10, 15 seconds of great advice. And if you follow it, I'm not saying it's gonna cure every problem you ever have, but
Mhm.
like it's really the bare minimum you can do for yourself.
Yeah.
Just take care of your body and do what you can while you can.
Let's get to the juice. Um, do ER nurses secretly judge patients? And what kind of things make staff immediately think, oh no? I mean, I fucking know that I would, but go ahead.
I mean, listen, my first job was a cashier at Maxi, and I was 15 years old judging people on what they were buying for groceries.
You're
We're
like,
humans,
wow,
we all judge each other.
76 bags of chips. Really?
We all judge each other. It's something that we do. So I can't lie and say I've never judged someone. Most important thing is no matter what I'm thinking, I am able to poker face it and still treat people with respect and equally.
Mm-hmm.
Side note. Sorry, what was the second part of the
What kind of things
the
make
wine?
staff
It's
go
the
like,
wine.
oh no, here we go?
I would have to say the biggest like red flag. I'm really spilling the secrets here, eh?
Yeah, you have to. It's the podcast rules.
Would be like atypical medication allergies.
What do you mean?
Okay. So there's like, let's say there's like really common things that people are allergic to. You hear about it all the time. Like, you hear about
Peanuts.
peanuts is okay for it's not a medication, but a lot of people are allergic to peanuts.
Oh, sorry, you said medication allergy.
No, it's
Sorry.
okay. But a lot of people are allergic to peanuts, shellfish.
Yeah.
In the medical field, you hear about iodine allergy, the
Mm.
contrast for scans and stuff like that. But then there's like allergies when you look at the list and you see a pattern and it's like 6 allergies and you're like, this doesn't make sense. Like, let's say it's a person that has like multiple visits for like, I fudge, I don't even know. Like, you're allergic to like 2 medications of 3 of the same family of medication. So let's say there's like, let's say a classic would be like Gravol, Zofran, Maxaran. All 3 are anti-nausea medications.
Didn't know
Same
that.
family of medication, but you're allergic to 2 of the 3 of them. and you only want the specific one because it's the
Mm,
only one.
mm.
So that's like a red flag, I
Where
would
you're like
say.
asking for a specific, those two don't work, but that one works.
Yeah.
Got it.
And look, I mean, it can happen,
Yeah.
but like that's specific and there's no like allergy involved. You've never seen an allergist to like test. It's like you can tell. It's like, it's horrible to say, but I'm able to tell when a person is having a real or a fake seizure. You laugh, but it's like, like you see these videos online and I'm like, oh my God. Why do I know the difference?
Between a fake and a real seizure.
Yeah.
It's actually sad that there's so many fake seizures that you can see them. Like,
Not so many, but you can
but there's
tell.
enough that you're like, okay, enough. Okay, but also on that, so I've had gone to the ER and I've actually gone, oh, sorry, I need to open that again. I've actually gone to, thank you, um, to see Cristina. Well, she was there when I had to go in. She was working, and I have stage 4 endo. I'm sure I've mentioned that before. And so I had this a cyst rupture, and it was so fucking painful. And the doctor on that was treating me was super super nice guy, and he was like, do you want more? Like, we gave you some morphine, but do you want some more? And like, I've watched so many fucking murder shows slash crack like drug addiction shows where I'm like, if I say yes, am I gonna look like a crackhead? I'm like, no, I'm fine. But meanwhile, I'm dying, but I didn't want to say yes to more morphine.
But we also get patients when I'm like, what's your pain from 0 to 10? And they're like, it's a 7. And I'm like, okay, do you want some? Even not, I won't offer morphine off the,
Jump.
like, off the jump. I'll be like, you want some, have you taken Tylenol? I don't know. Do you want some? No, because I want to make sure I'm feeling the pain when the doctor sees me. So like, no. Why do you want it? Like, the doctor might only see you in 3 hours. I don't want you sitting for 3 hours in the waiting room, suffering.
This is good advice.
So yeah, like, don't wait for your pain to be at a level that you can't manage it because then it's going to take more meds to bring it down. So yeah, there you go. There's a good advice.
Yeah.
So often I find myself telling patients like, listen, you're still going to be able to explain the pain, even if like
You
a
don't feel
Tylenol
it right
Advil
now.
is not, maybe it's going to help it like 80%. And I'm super happy if it does.
Yeah.
But like, don't not take it
I was
because you want to
literally
make sure that your pain is there to tell the doctor what's happening. Don't suffer for,
I literally was going to. I'm like, I'm gonna look like a junkie. I can't say yes, even though I'm in pain. I'm like, I can't say yes.
no.
He's
Take
like, I'm
the
gonna give
pain
you a little bit
medication
more.
when it's offered to you, please, because we don't want you in pain.
But
We want
also-
you to be well controlled. I don't think your pain's ever going to be 0 if you're coming in for something.
Yeah.
Like, let's get real here, but
also they wouldn't offer it if they had an intuition that you're a junkie. They wouldn't offer it.
the red flags.
Exactly. If there's red flags, they're not gonna be like, do you want more drugs?
We would wait. There's certain things also that as nurses, we can't just offer everyone. Fentanyl. Like, no, the doctor has to see you and prescribe it, and then we can give it. So, we have things that we can offer while you're waiting, and we want to make sure that you're not hobbled over in the waiting room crying.
Yep. Good. All right. Okay. Whew. This question.
I'm so nice.
This question, what made me think of this question is I went to the bank and I had to do whatever at the bank. And I was like, ugh, it's so annoying if you know someone that works at your bank and then you're waiting in line because you have to go to the teller and it's not just the machine. And you're like, oh my God, I know that person. I don't want to go to them. And then they open up and they see all my financial, like, it's like a money diary. It's so personal. And I was like, oh, I don't want to fucking go to that person at the bank. So then it made me think about hospitals, but both the ways. So here's the question. Can you refuse to treat someone if they're an old acquaintance, ex, enemy, or someone that you know personally? And part 2, can patients ask not to have a certain nurse?
Okay. I don't know, like there's like a whole like ethics thing. Like, obviously I'm not going to go and take care of my mom if she comes in, right?
Why not? That would, I think you should.
Well, because then you're giving her preferential treatment over other people. No, I know it's my mom. Like, but also definitely, like, I've had people come in. I'm like, oh shit, I know this person. This is so awkward
for them and you.
I feel like it's more awkward for me. That's what it's. So definitely I'm like, bro, like, can you take, I can't take this person. And,
Yeah.
obviously my coworkers are super understanding and vice versa. If someone will come to me like, Christina, I really can't. Please. I'm like, of course. Like, no, I don't want to, why would I want to make someone feel uncomfortable?
Yeah,
And like, could
exactly.
you imagine going into like, as women, as a gynae exam, and it's like someone you went to high school with, like,
Yeah.
okay, open, I'm gonna put the speculum in, just kill me.
I know. Oh my God.
I think I don't even know what's worse, gynae or like a teeth cleaning. I think I would die. I
What?
feel like the teeth cleaning is worse for
No,
me.
are you crazy?
I
No.
don't know. Like, I don't want someone in my mouth.
Well, you don't have dirty teeth. So you have
No,
nothing
but
to
it's
worry
still like
about.
a thing.
I know. I get it, but no, a gynecologist. That's crazy.
Both. Just kill me if I know you. Just kill me. I want a stranger. And I want no verbal communication while you're in there or in there.
Yeah. But
sorry, I hit the mic.
But also, have you ever seen a patient be like, no, I like go to you and be like, no, I please don't bring that nurse there. Like I know them from high school or college or whatever.
No.
Really?
No, yeah.
Okay. So
I
you
feel like it
haven't
would be more us, like, oh, I can't have that person. I know this and that. It's uncomfortable for me. And it's like, no problem.
Okay. Okay. Well, that's interesting. Okay. Next question. What's the funniest thing a patient has ever said or done while being completely serious?
So I would have to say when we deal with a lot of like patients with mental health issues,
Mhm.
and sometimes when you're not at your best, put it that way, you're a little disinhibited
Mm.
and you say things almost like, very brutally honest. I would say brutally honest, disinhibited. So you get a patient that's unwell mentally or intoxicated or whatever, and they are insulting, but like they will literally look at you and be like, why are your bags under your eyes so bad?
Oh.
And you're like, shit, do I look that bad today? Like, it's something so stupid. Like, last time I had a patient who's like, you fat bitch. And I'm like, oh, I've been going to the gym 3 times a week. I don't know what I did.
She's the furthest thing from fat. You can't see from here, but yeah.
No, but you know what I mean? Like, oh, you
Furthest
fat
thing.
bitch. Or like, I had the best, I think the best one I heard. Bless her heart. The nurse was so nice, but the patient was like, bitch, you should write a thesis on how ugly you are.
Oh.
And it's like, how do you not piss your pants laughing? You just want to laugh, but you're like, listen, ma'am or sir. Ma'am, sir, excuse me. You can't say that. It's not nice. And you're like just dying. Like, how do they see this? Like,
Yeah.
you should shave your chin hairs. I'm like,
You're like, actually, I'm trying to break them. So, oh my God. Okay. Yeah, you must see it all. You must see it all.
why are your teeth crooked?
Oh,
I'm sorry, I couldn't get braces when I was young.
okay. Actually, thinking
They
about
really
that,
get in there.
my dad, when he had, I didn't get into my dad passing podcast. That's coming, but anyways, but the details. So when he had cardiac arrest and a heart attack in 2019, and when you have like he had no oxygen to his brain for I think it was like 27 to 35, something like that, 27 to 35 minutes. And they thought that he would be brain dead. Anyways, he woke up out of his coma, not medically induced. It was a coma all on his own. And he woke up, and when you're at that capacity, it's like you're like a 12-year-old child. Like, have you
That's it.
ever,
Like, I
yeah,
would almost compare them to like, like a
yeah,
kid, like a 4-year-old. It's like, why are you so fat?
yeah,
Why
like,
is your nose so big? Why do you have a mustache? Why are your eyebrows so close together? And it's like,
you know what my dad said to a nurse? He's like, oh, you need to wear more makeup.
but yeah, that's what they
We're
say.
like,
And you're just
shut
like,
up. What are
you're
you
just
doing?
like, shit, true. But like, leave me alone right now.
She
Like, I'm
just
just trying to make my paycheck
No,
here.
I swear to God, she giggled and was like, okay. And then he
Yeah.
had a babysitter.
You
Yeah.
just laugh.
No.
Honestly, I've never been affected to the point that I cry when patients are like that. It's
Sure.
hard not to laugh. And like for me, I want to laugh because I'm like, oh, shit, yo,
Well, I
that's
would
so
laugh.
funny.
I don't think I'd laugh and be like, okay,
I've been
anyway,
called
so
Barbie once for wearing pink. Like, okay, Barbie. I'm like, shit, this bitch got
honestly,
me.
nurses don't get enough credit. I swear to God. Okay, so here's the next question. And this is a deep one. So think very carefully. After seeing so much trauma, accidents, and emergencies, has it changed the way you live your own life?
For sure. I feel like I sound so cheesy, like answering this question, but
No.
100% because you just learn to value life and autonomy. Autonomy
Mm,
so much more. Like you don't realize how much you have and how blessed you are until you see
loss.
not just loss, but the way others are living and what other
Mm,
people are going through.
it's true. Health is wealth.
Health is wealth, and
Yeah.
you've got to, like you book a trip and like, or book a trip. Like I'm using a trip as an example because we like to travel.
Hmm.
And it's like, oof, maybe I shouldn't have booked. It's like the third trip this year. And it's like, look,
Live your life.
tomorrow that can change
Ain't
and you might
promise.
not be able to get on a plane. So you need to enjoy it while you can. And I'm really talking like seeing coworkers go through things, unimaginable things that you can't even think of, that I just can't even get into. Patients, the way they come in, that they're living 100%.
Yeah. And like, do you find that like, do you drive differently? Do you treat your parents differently? Do you treat your husband differently?
Drive different. I drive a Vespa, even though
Bah.
I work in an emergency and I see all kinds of crazy shit. And people are like, how do you do that if you work there? And I'm like, look,
You're like, honey, it gets me there quicker.
live free, die young. No,
Oh no.
no,
Stop.
no. But like, I also believe that everyone has like a fate, but we won't get into that because that's not the theme of the podcast.
Of this episode.
This
I'll
episode.
bring this bitch
Yeah.
back. Don't
But
worry.
yeah, you just have to enjoy everything you can while you can. And really, I say it, even though I do it, I sweat the small stuff, but don't fucking sweat the small stuff. Because at the end of the day, it's so fucking insignificant and really means nothing.
Do you find that like I know like it's like a cop or like nurses and doctors, like you kind of get numb to certain things, but does like you're numb because you have to focus, like instead focus on all your work and like save this patient and fix this patient and do your best job. But like outside of it, do you find that it has given you anxiety about your own family members and yourself, or are you still the same?
So it's funny because I think of like a coworker I used to work with, and he was like, Chris, we turn it off so much at work, but sometimes you got to turn it on and live the emotions.
Mm-hmm.
And I always remember that. I always remember this guy saying that to me, and it's true. Like, you can ask me 95% of the things I see, I don't remember. It's crazy because you see so many things and this and that, and you have to turn it
10
off.
years, yeah.
But sometimes you have to feel the emotions to get through it and really, not connect, but remember. And it just helps you appreciate things. And
So it doesn't cause anxiety?
for sure, I have anxiety because also I've been through like a health scare where, like, on my way to work, I was like rubbing my eye and then I like, opened my eye and I was like, why can't I see out of my eye? And then I got to work and I was like covering one eye and I was like, I can't see. And then I would uncover and I'm like, I can see. And then it turned out to be something so crazy. Like, I have MS. Like,
Mm.
so from there, of course, I have like health anxiety because it was like something that turned into like a big thing that can like really affect my life in the long run if I don't take care of myself and follow treatment and stuff. So any little thing, sometimes I like panic, and then my coworkers will be like, Cristina, they'll bring me back down to reality, and I appreciate them for it. Um, but yeah, like, and then on the flip side is we see people panic all the time and it's nothing, but when we tend to panic, it ends up being something big. So
Do you
it's to find that balance.
we you glazed over your MS. Um, but do you want to go into that or is that private? Do you want to talk about like how you're handling it, where you're at?
No, I'm super vocal about it. Like when people ask me and stuff, because people are like, I can't believe you have that. Like I see your videos, you're working out all the time.
Yeah.
And it's like, yeah,
Yeah.
like because there's so much that we don't know or didn't know about that, like even 10, 15 years ago. But it's
Mm.
like 10, 15 years ago, you would get diagnosed with MS, you know you're ending up in a wheelchair. But now,
Mhm.
like modern medicine has good things,
Yep.
so there's different treatments available now. And I'm definitely following like what my specialist recommends because I trust them completely. So I'm taking the medication and it's working. I
It is.
exercise. I try and eat healthy. I drink in moderation, except for tonight. Too
My bad.
much, loose lips, Um, life is about balance.
Yeah.
And it's just I'm trying to make sure that I work on my balance, work on my fitness, work on everything to prevent myself from it progressing.
Yeah.
And people who have questions or whatever about it, I'm super open to talk about it. And
Mhm. I'll tag her in this. So if there's anyone who's has MS, wondering if they have MS, a family member.
I can't give you like super crazy health advice because I'm not an expert. I follow my neurologist and what he suggests because he's the expert.
Yeah.
And that's the path I'm going on. And whatever path you choose to go on as someone, I respect that. But that's the path I've chosen to go on and it's working for me.
Good. All right. Got some juicier questions. This one isn't juicy, but a lot of people ask this, and I've been curious too. And I've seen some interviews of some actors, and I'm like, ooh, like I remember. Oh, what's his name? Oh, McDreamy. What's his name? And Patrick Dempsey. I saw an interview of him, and he was like,
Never
yeah,
watched an episode of Grey's Anatomy, by the way.
the worst nurse of life.
Nurse Ratchet.
Nurse Ratchet. Anyways, and he was like, "Yeah, no, I remember it. Like I read the script. I said my lines, and I really sounded like I knew what the fuck I was talking about. But no, I don't remember anything, and I don't know any protocols or anything." And I was like, "That sucked," because he basically had like a D grade medical degree by being on the show for like 175 years, however long he was on it. So anyways, my question is, what's something for medical shows that is completely fake?
Okay.
Talk to
First
us,
of
girl.
all,
Talk to us.
if you watch 10 episodes of a medical show, you are not a medical professional. Stay in your lane. Number one, I don't care who I
Oh,
offend with
like a
that
Google
comment.
doctor?
Yeah.
Go on.
Okay.
Yeah.
Back off. Stay in your lane. Number two, love the pit. Everyone loves the pit. We
Never
all
seen
watch
one
the pit.
episode, but Jess watches it.
Hater.
Shout out, Jess.
Um, 6 doctors are not transferring patients from an ambulance stretcher to a hospital stretcher. Okay.
But what if they're a large?
No.
Oh.
Large, okay, we're gonna get more people for sure, but that's an exception. It's not every
True,
patient that comes in. I'm gonna shut it down right there.
Okay. What
So
else?
the cases are real. The things, a lot of the stuff they're saying is real, but it's less doctors hands on, more nurses hands on. I would have to say,
Oh.
like, they tried to make like an episode about nurses where she was like shaving the guy's face. I've never shaved someone's face in 10 years.
Well, maybe the orderly does.
Rarely.
But only if they actually a face. Yeah. No,
when the
that's
emergency, no one's face is getting shaved unless
They
it's a
know.
medical emergency. Okay. So
and they
like
have to shave for like an IV or like something.
well, that's it. So
Yeah.
like already that guy, he was like, oh, thanks. I look so much better. Listen, I love that for the patient. It's going the extra mile, but we don't have the time to do that.
Okay.
Respectfully speaking, I wish I did. And if I did, even being a nurse and not an orderly, I would. But yeah.
So you find it's pretty accurate otherwise.
Otherwise, like the illnesses they have and the treatment they're getting is super accurate.
Okay.
Medication doses and stuff like that. Like, yeah.
So did you ever used to watch House or no?
No.
Okay, those ones were crazy. And like I started watching when I was in Dominican for a month. Don't ask me. It was like pretty much the only show that they had over there. And I was like, I got to like season 3. I was there for a month. Don't judge me. And I was like so into it. And I was like, these can't be fucking real. And they're like, they came in and they're like, yeah, like something so small. And they're like, you're dying from meningitis, but you thought it was you thought it was a splinter, but it's meningitis. And I was always like,
Splinter to meningitis, maybe not, but like splinter to flesh eating, it could
oh yeah.
happen.
So okay. All right. Well, anyways, oh sorry, you have to open it again. Sorry, everyone. I'm
Canceling the
so annoying.
podcast.
Nope. Okay, there we go. All right. Next question. Have you ever had a patient flirt with you in the middle of an emergency? They're there for stitches, a heart attack,
Not
going prepping for
really,
surgery. Tell
but
us.
I'm thinking of like this one patient that came in. He was like a bit of a frequent flyer. Like
Frequent flyer.
it's not his first rodeo. And
So he's a hypochondriac.
okay, I'll use like a fake name. So I'll use Vanessa as a name. Um, so I'm like, oh hi, I'm Christina. I'll be the nurse. And he was like, hey Christina, is Vanessa working today? And I'm like, actually, yeah, she is. I fucking love that girl. I want to fucking marry her. I'm like, oh, okay. Okay, sir. So I went and got like my friend. I was like, hey, girl, Mr. So and so's here. Oh my God, don't tell me he's here again. Russ is over. He's like, I love you. And I'm like, oh my God, just laughing in the corner.
What was he there for?
He had fallen. He was drunk.
Okay. Frequent flyer. Got it.
Well, it's not the only thing people come in for often, but he's been before for other things.
Okay.
Super nice guy.
And here's something that we see all over Instagram, but let's hear the Montreal version. What's the weirdest object someone came into the ER with?
Can I just say that of my almost 10 years working, no one has ever come when I'm working in triage and been like, sat down and been like, I'm like, hey, what are you here for? And they're like, well, I have this lodged up my ass. Never. Like, where are you? I'm waiting for it. I want it. I hear about it. I see it after when they're brought in.
So it's never happened to you.
Well, it's never happened to me when I'm in triage. And that's like, I'm dying to get like the beginning of the story because I'm like, I would be asking all the questions. Okay.
And how did that happen?
Yeah.
And what time was this that?
What time? Were you drinking? Did you,
was there lube involved?
Yeah. But I've seen it all. Well, all. From eggplants, jam jars,
jam jars. That's a mason jar.
Bon Mama, shout out. Marbles in the urethra. So up the pee hole. Yeah, that one I was a bit freaked out about.
Wait, a male.
No.
Okay, see? My brain went male.
Yeah, so I know we judge, but yeah, it's
right
not just
there?
Men that stick things up. It's also women.
Oh,
so,
here we go. Oh my God.
The eggplant, the patient came in with it up, but then it ended up on the floor.
With a cough or?
I wasn't there to witness it coming out, but I saw it on the floor after. So,
That's so... Okay, what else? Anything else that you can think of?
You hear about all these other crazy stories and you're like, did that really come in? Like, yes, is it an urban legend?
They do.
You hear like coworkers are like, this person came in with a mouse up there. And I'm like, really? Like, I never heard this. Oh, another one is I've never seen it.
Tell us.
Never seen it, but it happens is drugs.
Oh, mais oui. Smuggling or just like they're trying to get high?
I don't know. No, smuggling, but I don't know like the context and I've never seen it.
Hello, euphoria?
Yeah, like a euphoria type of situation. Situation.
Yeah. Sorry, once more. And I'll keep it
about to get canceled.
I know, I'm sorry. Okay. Do nurses have a code look they give each other when a patient is being dramatic? That answer is yes, if I've ever seen one. I would. Fuck yeah, I would. Oh, mum's the word. Just know that if you're an annoying ass patient, you're an annoying person on the street, in a school, in a cinema, and in the ER.
It's not just patients. Annoying. I think we have a look for everyone.
Oh, like family members.
Coworkers.
Oh yeah.
Well, even does. Like us having dinner, like a big dinner party. If
Yeah.
someone says something across the table, I'm looking at Sam and I'm
Yeah.
like,
I'm like, mm-hmm.
so again, it's like, it's in all walks
I
of
guess
life,
that's
but
it's a rhetorical question. Everyone has looks. Okay, fair enough. All right. Do doctors and nurses cheat on their spouses with colleagues? Give us the affair juice. Is it like the shows? Like Grey's Anatomy was like wild, wild, wild.
I would have to say that my department is pretty boring on this.
Hmm.
But
You've heard stories.
no.
Oh.
Well, I've heard rumors, so I don't validate
I mean,
rumors.
in any hospital,
Unless I'm seeing something, for me it's like, people are making
it's
rumors.
hearsay.
I don't entertain it. I
Boring.
will say recently, I think it was like last summer, the summer before, we had what we thought was a couple come in after like a trauma, and both of them were patients, and then his wife showed up. So we were all kind of like confused because, like, why was he with this woman? And then the wife shows up, and then the wife goes to see him, but not her.
Mm-mm.
So we're all like, what is happening here? She acted like the other woman was like a stranger. We might have put them next to each other purposely to see the dynamic of the three. And it was awkward. Do we know the story at the end of the day? No, but the stories were going and the hypotheses were flowing, and we were like, oh, well, this is happening, and this, like, you're looking at it and you're like, well, no, clearly that's his wife and that's his mistress, because you're like, well, this is so awkward, like.
I would have been like, hi, sir. Is this your lovely wife? I called her right on the spot. I don't condone cheating, if you can tell or not.
I think I was like interested in going, and people were like, Cristina, stay out of it.
They're like, this isn't Grey's Anatomy. Sit
Yeah.
the fuck down.
I was like, I'm just gonna sit and watch.
No, see, no, I'd slap on some scrubs and walk right in there and be like, ma'am, are you the wife? Get the juice and then leave. Be like, that's a mistress.
There's been like family drama too, but that's like less like whatever. Like, oh, this child doesn't want the update given to the sister. And it's like,
yeah,
okay, like.
But honestly, fair enough.
I stay out of it.
I get that.
I stay out of it. The less contact, like the less involved I have to be in that, the better.
You're like, and I've serviced him. He's healthy. He's better. My shift is done. Ciao.
Yeah.
Yeah.
You guys deal with your stuff. I'm not involved.
Okay. So my last question is, and this is a little bit of a personal question I want to know, because sometimes I'm like, listen, do I go to an ATM now or what the fuck?
ATM?
Yes. Has someone ever tried to slip cash to triage to be seen sooner? And if so, how much?
I wish. No, okay, seriously, I'm not taking your money.
But
I swear to God.
Has anyone ever tried to?
No.
Really?
I swear to God. I swear on my mother, in the 10 years, never. Never.
Not a quick 20?
Does that mean people are cheap?
It does, yeah.
No. I will say certain patients that come often will bring food, like we'll order like, do you guys want some pizza? Or, like donuts, coffee, like the usual. Patients will obviously bring us like stuff like that. That's like a recurrent thing. Like,
but that's just like manners. I'm talking like shysters.
But I swear to God, no.
I can't believe that.
However, I have had, when I wasn't a nurse and I was working administratively, a young girl came and she was seen by a doctor, very handsome doctor that's still working, super nice, super knowledgeable, super handsome, just across the board. And she came back and she was like, hi, I was a patient yesterday and I was treated by Dr. So-and-so, and I just want to give him this, and slid her name and phone number on a piece of paper.
Shoot your shot, girl.
I wanted to die.
Why? Shoot your shot. Why? Good for her.
Because I was like, first of all, your phone number's in the chart.
Yeah, but he doesn't know that she's interested.
Yeah.
You gotta shoot your shot, man.
I'm not gonna lie, I didn't give it to him. I threw it in the
You
garbage.
didn't? Oh, no.
I'm sorry, guys.
Listen. Oof. You're terrible.
I am. This was
Wait, is he single?
I don't know if he was single
So you
back
cock
then.
blocked him, is what you're saying.
I might have, yeah.
Was she like,
I knew that she wasn't his type. Let's put
okay.
it that way. I just
Wait,
had a hunch.
am I allowed to say the hilarious story? I don't even remember the doctor's name, but the joke that we made. Am I allowed to say that story?
Yeah, yeah.
Okay. Okay. So as I told you earlier, that I went to the hospital with a ruptured cyst, and it was like literally the most painful thing. I've had my appendix out and I've had kidney stones, and a ruptured cyst in the ovary is the most painful out of the three.
I'm
And
laughing thinking, oh,
yeah.
you guys are so
And I'm
dumb.
like, Christina, I think I'm dying. I need to come to ER. Like, I'm dying. And
Side
she's like,
note, I didn't do anything for her. I literally was working that shift.
yeah, but you took my blood.
Yeah, we did the blood pressure.
Yeah. No, you took a
And
blood test.
we did the blood test. But like I didn't accelerate her being
No.
seen. Like
Oh, no.
because
No.
yeah.
She was just working at the same time. I'm like, are you there? Like, I don't know what I'm supposed to do. And so anyway, so she was just there while it was
A
there.
super nice doctor.
Yeah, super nice doctor. And so I'm there freaking out because I'm Googling ruptured cyst, and I was like, am I being a little bitch to go to the doctor? But when I tell you, no, when I tell you 10 on like
No,
10,000
it's bad. It's bad.
on
It's a
10
medical emergency.
No, it is. It was so painful. But one of the things that popped up, if you Google it, is like if ovarian cyst bursts, it can cause, if untreated or it's super bad, it can cause an infection. So I'm like, oh my God, last thing I need is like an infection inside my, like,
For
worse
sure.
than what I have, you know? So I go to the doctors and and this is when he's like, I'm going to give you a little bit more morphine. Do you need more morphine? I'm like, no. And he's like, I'm going to give you more. I'm like, okay. And then so he gave me a little bit more, and it's just him and I in the room, and Christina's in the back working, doing her own thing. And he's like, do you have any other questions for me? And I was like, well, yeah, actually. And then he's like, oh, I'm like, these fuckers. And I was like,
These
I'm like,
fucking assholes.
no, I swear to God, I'm like, do you think that I need like antibiotics? And he's like, what? And he closes the door, and I was like, what the hell's happening? I'm like, I swear to God, I was like, what? And he's like, why do you think you need antibiotics? And I was like, well, because of an infection, maybe. And he's like, do you is this like, are you asking because like you do need to get an STD test? I'm like, sorry? And he's like, sorry, no, I'm just wondering why like you think you have an infection. I'm like, no, I literally Googled ruptured cyst. And he was like, oh my God, I swear to God. He's like, I thought like maybe because like a lot of patients wait until the 11th hour to bring up like a concern they have. And it's usually something like private or embarrassing, like an STD. I'm like, no. And he's like, should we tell Christina? Should I fake and tell Christina to do, what was it, a piss test, right? A urine test.
He asked for a urine, chlamydia, and gonorrhea test.
And then I'm like,
fucker.
Yeah, and he's like, I'm just gonna say like, I'm gonna go to her privately and say that we need to get one done immediately. And I'm like, fuck yeah, let's do it. And basically he's like, no, there's no infection, you're fine. I'm like, okay. And he's like, I'm gonna do this. So he goes, I see him, he leaves the room, opens the door, leaves the room. I see him whisper to Christina like, hey, we're gonna need to get this test done. And I see her like give a side eye look at me.
Okay, you want to talk about judging? This is my friend of 20 years. And I'm like, this fucking bitch doesn't tell me she thinks she has an STD that's coming in. This is embarrassing now.
And I was like, oh my God, okay, acting and scene. So she comes in, she's like, did he tell you that we need to do and I'm like, Christina,
I wanted to die. These fuckers.
And then I told her, she's like, I swear to fucking God, I was freaking out. I'm
Yeah,
like, no, you don't need to do
bitch
it.
Isn't telling me she thinks she has a dirty vagine and is coming to the hospital. And
I've been single for so long. If I had an STD, I was raped and drugged.
It was a real medical emergency. She had a ruptured cyst.
No, I did. Yeah,
and
it was
thank
bad.
God she didn't get infected and didn't need, we treated it. And
yeah, but all to say, what a great fucking
they got
joke.
me. Yeah,
it was a great joke. Honestly, seeing your face and the side eye like this, like
that was the judging side eye.
No, you were like, Sam, how dirty, you dirty whore,
dirty bitch.
Anyways, thank you for joining. We're gonna wrap it up with cheersing. Do you still have? Oh, you don't even have a drip drop. A drip drop. You guys,
I'm gonna die. I'm supposed to go work out tomorrow.
I'm flying out tomorrow. tomorrow. But
Yeah, this bitch is leaving on vacation.
well, thank you all for joining. And Cristina, thank you. You'll be back again. Hopefully we get some questions from our 3 viewers. Callie,
I hope
Yanni.
you guys enjoyed this. I'm so embarrassed.
Why? No, she did amazing. Everyone cheer her on. Christina, the ER nurse with the...
Don't come see me with your fucking problems.
Don't.
I'm kidding. If you have a problem and you're very worried, I'm happy to try and help to my capacity, but also leave me alone.
And also, if you have STDs, they have great tests.
No, STDs, you can go to an STD clinic. Don't come to the emergency.
All right. Have a great night. Bye-bye.